everyone. As she said, I'm JJ Gossett, and I'm in the School of Health Professions. I'm actually a second-year physician assistant student, and I'm the PA class of 2018 president. Woo. So if you don't know much about the PA program, I feel like sometimes people are a little confused as to exactly what our program's like. It's kind of different throughout the state and amongst states. So here at UTESCA, our program is 30 months long, so 15 months are didactic coursework, and then 15 months are clinical rotations. So I'm actually on my second rotation out of 15, so kind of on the home stretch. My first rotation was in pediatrics, and now my second rotation is in dermatology in my hometown. So it's really nice to get to go back home and see my family and everything. So what PAs do is we actually work in, as you can tell with my 2 rotations I've had so far, is that we work in many different fields, anywhere from family medicine to ortho trauma. So we diagnose patients, we treat them, we prescribe medications, we assist in surgery. We do all of those different types of things. So a little bit about me is I'm originally from a town by the name of San Angelo, Texas, and I'm very, very close with my family. So I finally left home for undergrad. I went to Texas A&M University, and that was about 5.5 hours away from home, so that was a big transition for me, but I absolutely loved it. And then after that, I went to Baylor University, and I went to graduate school there. So while I was at Baylor University, I taught an undergraduate course in nutrition, so I also really enjoyed teaching. And I also had my thesis focus of research on childhood malnutrition, because that's something I'm very passionate about. But as you can kind of tell with that brief little overview about me, it took me a little bit longer than some to end up here, because I'm finally here at UTESCA in the PA program. So I want to tell you kind of why it took me so long and why 100% it is okay that it took me so long. But trust me, I'm just as excited as my dad is for me to finally get my first big paycheck at the age of 27. I'm sure we all understand what that feeling is like, though. So whenever I was a child, I used to always pray to have the gift of healing. And I remember I used to always be really devastated and disappointed, thinking that the Lord wasn't really listening to me and answering my prayers. You see, I thought that the gift of healing was where I could touch someone next to me and I miraculously would heal them of all pain and suffering. A blind man could see, a paralyzed man could walk. So of course, I was disappointed at 7, 8, 12, 15, my whole life growing up and praying for that. And then it wasn't until I was a senior in college, hence why it took me a little bit longer, that I had my career-defining moment whenever I visited Ghana, Africa. So whenever I went to Ghana, I was exposed to the devastating reality of starvation and the lack of medical care. And my life forever changed whenever a sick child peered into my eyes and I felt like he captured my soul. This boy was not someone who was just a nameless face on some advertisement, asking for money for a donation to a wonderful cause, but it's so much different whenever you're not viewing it from the comfort of your living room. This boy, he had a face, he had a name, and he had a story to tell me. And it was at this moment that I actually realized that the Lord had answered my prayer, that I could pursue medicine and that could be my gift of healing. So in the end, my biggest goal is to make even somewhat of the impact on someone else's life just as big as the Ghanaian child made in mine. He was such a light in what is the darkness of life. I want to set people free from pain and suffering, both medically and spiritually. And becoming a PA, I think, will help me achieve that dream. So if y'all remember anything from this talk, if you snooze the whole way through, just remember these 3 main things. These are kind of my 3 main lessons to you. So first of all, if it took you a while to get here, or if you're in a career path, which most of us are, that it's going to take you a while to get where you're going to be, there's going to be speed bumps along the road, and that's okay. Because I know that in the end, you will all go and be exactly what you were supposed to be and do what you're supposed to do. Secondly, I want us all to remember that behind every diagnosis, behind every disease, and behind every treatment that we do, there is a person there, a person with a face, a person with a name, and a person with a story to tell. And lastly, I want you to never forget that each of us has been blessed with a gift. And this gift is one that we can help those who cannot help themselves. Thank you, and God bless.